Hi everyone. This is a Collaborate session on Health Informatics, any of the 4 programs, and I'm going to go through the program policy manual and just answer some, go through expectations and tips and helps and discuss things probably for about 20 or 30 minutes. And then we'll have the session recorded and available to anyone. So I'm going to start sharing the program policy manual, and so that's the file you'll see. Okay, share now. Okay, so this is the table of contents. This manual is for the 2016-2017 year, and I'll be updating that. And it's available within the orientation, the new student orientation course on MyHills, which everyone is automatically enrolled in. Anyone that enrolls or is admitted to the Health Information Technology Program, Medical Insurance Coding, Healthcare Documentation Specialist, or the Health Unit Coordinator Program are automatically enrolled in the Health Informatics New Student Online Orientation. Just one quick tip. Everything within the Unit 10 folder of the online orientation course is available in MyHills within the Health Informatics organization under the folder entitled Program Information. So I try to keep those 2 folders the same. So all the documentation that you see within Unit 10 of the online orientation course will be in that program information folder within the Health Informatics organization. So just a little bit, well, and I guess too, I should introduce myself. My name's Sarah Cottington. I'm the Health Informatics Program Director. And also in the session is Carol Yoakum, who's our HIT, another HIT professor and full-time faculty here at Indian Hills. So we'll start off with the program policy manual. You can see the table of contents there. We have mission, goals, and philosophy for each of the programs. And I would recommend that you read through this program policy manual because there may be some things that are important that or something that piece of information that I may not cover in the session this morning. So be sure to read your program policy manual. There's sections that are applicable to each of the 4 programs, and we'll just work through. Some things are applicable to Indian Hills Community College as a whole. All of our 4 programs are online, so sometimes things are a little different for our students because they're all online and remote. I make it my priority and goal to, if there's anything that you should never have to come to campus, come to Ottumwa, Iowa, to be enrolled in our online program. So hopefully you can, you should be able to be in our program, be enrolled, and complete everything remotely, virtually, whatever it is. So this is the welcome letter and everything. We're very happy that you've thought of our program and want to enroll, and we're excited about health information. It's a growing field and there's a lot of opportunity right now. So I'll let you read through the mission, vision, philosophy, goals, and everything at your leisure. I'm going to skip ahead to page 9, and maybe I can do that on the side. Yeah, here. Okay, I've got figured out now. So this is the curriculum plan for a full-time student for the Health Information Technology program. The program's 7 terms, and if you'll notice there, we have a spring and a fall start. So each of the terms follow a pattern that they're offered twice a year. So term 1, all of those courses, even if they're an arts and science course, like basic anatomy and physiology, our program can guarantee a spot for you in the online courses for BIO 161 and BIO 199, because basic anatomy and physiology lab is also an online course. We can guarantee spots for you in the fall and the spring terms. There may be terms that those courses are offered every term. For example, the Computer Essentials course, I can pretty much guarantee that there's an online session of that every single term here at Indian Hills, because that course is a requirement of a lot of different programs. So it's one of those things that if you do need to take it a different term, you probably will be able to get into a section. If you notice the courses with HIT in the beginning, those are HIT core courses, or MIC. Each program has core courses. They usually start with HIT and the course number. Those are prerequisites for courses in the next term. And the programs are designed to build on each other. And so there'll be a requirement. For example, HIT 125 and HIT 126 are prerequisites for the HIT core courses in the second term. And you need to take those courses and pass with at least a C average, which health sciences as a division has a different grading scale than arts and sciences here at Indian Hills. And so RC is at least a 78%. 78 to 84% is a C average. So students can go part-time. I try to work very closely with those students to make sure that they take the courses in sequence in the right order. And, you know, each person is kind of different. So some people may already have some of the general education electives and course requirements. Maybe you've taken medical terminology before in the past and it would transfer in. Whatever the case, I can help you look through a schedule and make sure that everything's good and that you have a plan. Or you yourself can, there's a new function now on Web Advisor, and it's on the right side of the menu on the home page underneath academic planning. And student, there's a function now called student planning where you can plan out the terms. I'm not 100% sure that the prerequisites are built into that yet. So even if you do that student planning function, please go ahead and just send me a copy, and I can confirm and verify that your plan in place is good. So this is the full-time curriculum plan and as the courses are laid out. There are some courses that don't have prerequisites. Most of the, like for example, pathophysiology, you could take that. There's also a few of the HIT courses that we could work around. For example, health law and ethics in the third term, that's offered in the spring and the fall, and it would be one that if you need to, you could take it. So otherwise, that's the plan laid out for a full-time student. Okay, so I'm going to go on to medical insurance coding. Medical insurance coding is basically the exact same courses for the first 4 terms of the HIT program. The only difference is that within term 2, there's an HDS fundamentals course, which is a medical transcription course for the HIT program. So MIC students do not have to take that transcription course, HDS fundamentals. We have a lot of students, and the programs are designed to do this. We have a lot of students that may decide they enroll in the coding program, and they may decide to go on in the HIT program and complete the 3 additional terms or and finish that degree. And it's very, very easy to do that. You would just have to pick up that HDS fundamentals course. So the medical insurance coding program is 4 terms or 12 months. And again, it follows exactly with the HIT program, what you just saw. Each term is offered twice a year, fall, spring for term 1, winter, summer for term 2. And also, again, you have the core courses that build on each other and the electives. You'll notice in term 2, there's professional experience 1. This is your first clinical for MIC and HIT students. The first clinical is a 40-hour on-site clinical, preferably at an HIT department at an acute care hospital. That's the traditional setting for health information. And we work with hospitals where the student lives. How the process works is the student submits their top 5 choices, top 5 requests for the professional experience 1 site, and then I, as the program director, reach out to that hospital and HIM director and see if they're willing to accept a student. I complete the logistics of getting a site agreement together and liability insurance with the organization, and then notify the student of where they've been placed, and notify the site supervisor of the student's name and that they will be contacting them. I give the student the site supervisor contact information, and then the 2 of you work together to find a schedule that is approved and works for the student and the site. We have students schedule the 40 hours a variety of different ways through the 12-week term. And sometimes the sites, the practicum sites may have specific requests where, you know, the best days for them to have a student are Thursday or Friday. And so the schedule is approved by the student and the site supervisor. The 40 hours could be broken up into 1 day a week, 8 hours a day for 5 weeks, or it could be 2 4-hour days for 5 weeks, or 1 4-hour period for 10 weeks, or some students who work full-time and are very busy, or sometimes the site will request it too, that we would just like the student to complete the 40 hours within a 1-week time frame. And so sometimes students working full-time, they'll take a week of vacation and complete their clinical all in 1 week. So it's, again, a variety of different scheduling options. It's one of those things that I can't lay out exactly how your professional experience one will be, because it is in the real world, in a real life healthcare organization. And so it can vary from term to term, which hospitals are willing to accept students. Of course, we have a concentration of students in Southeast Iowa because Indian Hills is located in Ottumwa, Iowa, but we also have students who are who live in other states, or even we had one student recently who was on an Air Force base in Germany, and we still were able to complete the professional experience one wherever the student is located. We can usually make professional experience one work. The medical insurance coding students have a second professional experience in term 4, and so do HIT students. This professional experience is 200 hours. However, recently, within the last year, we have made and converted that professional experience to a completely online practicum. So it has a coding focus where the student codes a variety of practice settings, and hopefully we'll have a more consistent experience across the practice settings, because healthcare organizations range and vary. And so a student who was at a university hospital or a large teaching academic hospital is going to have a much different coding experience than someone who's at a small critical access hospital, who may not, that hospital may not even deliver and have obstetrics and newborn patients, or they may not have a wide range of surgical procedures that's completed at that hospital. So one of the advantages to having the professional experience facilitated online is to provide that more consistent coding experience while you can practice coding and increase your coding skills and proficiency. And then also the focus is on the CCA exam prep, and that's the Certified Coding Associate credential that you would be eligible to sit for after graduation from the first 4 terms, or from the 4 terms of the medical insurance coding program. Our program in April became PCAP approved through AHIMA, and that stands for the Professional Certificate Approval Program through AHIMA. And there are 28 schools in the United States on the school directory who are PCAP approved, or coding programs who are PCAP approved. So it's a very good coding program with a good health information foundation that would allow you to go on within the HIT program, or even with your employer, would allow you to go on within health information. Okay, so that's the medical insurance coding program. Real quickly, I'm going to go through the healthcare documentation specialist program. Again, it's built as it's a diploma program that's 4 terms, 12 months in length, and designed again to be a stepping stone into the health information technology program, that students could make that decision to go on in the HIT program very easily. This course and program varies a little more widely than the medical insurance coding program from the HIT program. But essentially, there are a lot of the same courses. This program is built the same way, with several prerequisites that are required to lead into the additional terms. So they're meant to be taken in sequence. This program, however, only has a fall start, so it starts towards the end of August, and these courses then would only be offered once a year. So term 1 is offered in the fall, term 2 in the winter, term 3 in the spring, and term 4 in the summer. And again, you'll notice that there is an HDS practicum in term 4. However, this practicum, as with the professional experience 2 for MIC and HIT, is completely online. It's a 200-hour practicum, and it's facilitated by HIT faculty. However, it is completely online and enables the student to have a consistent experience that is in a variety of practice settings. And another reason, too, that the practicums are online now is our industry with transcription and also coding, more and more those work settings have changed, and the employees work remotely and telecommute those responsibilities. So to have a student observe a transcriptionist or a coder is kind of hard to do when they're not in the healthcare organizations within, as some people say, within the brick and mortar of the building. So that's another reason why those practicums are virtual now and online. So as with the MIC program, HDS is a diploma program, and the core courses must be passed with at least a 78% or a C average. The HDS seminar course, too, I want to touch on that, because this program also has a certification that's available through AHDI, which is the Association for Healthcare Documentation Integrity. And the HDS seminar course prepares you to sit for that certification. Okay, and then last but not least, it's our Health Unit Coordinator program, which is 2 terms or 6 months, and is definitely a starting point for a variety of different types of students who maybe aren't sure about school, aren't sure about health information, and so this gets their foot in the door of healthcare, and with school too. And again, this program is designed so that you can decide to go on to any of the other 3 health information programs very easily. The first term is only offered in the fall. This program, again, only has a fall start. So it's offered during the fall. It has a lot of the same courses with computer essentials and medical terminology, and then again the 2 introductory health records courses. The second term is during the winter and offers an employment prep class, which we also require of each of the other 3 programs. There's a more specific class to this profession in the Health Unit Coordinator class, and then the Health Unit Coordinator practicum. And because of the profession of Health Unit Coordinator, unit coordinators are usually at the main desk in a med-surg acute care hospital setting. However, this program would give you the skill set to be in a variety of different practice settings, but the HUC practicum is mainly focused preferably in an acute care hospital on the med-surg floor, and is during the last 4 weeks of the winter term. So it's a full-time practicum which consists of 4 40-hour weeks for a total of 160 hours. Again, the student submits their top 5 requests of regional hospitals located near to where they live, and then I would work with those hospitals and set up the practicum and notify the student and notify the practicum of the student's name, and allow the student and the site supervisor to set up an approved schedule. One addition that we have added as an option within the first term of this program, which isn't reflected here because this is this past year's program policy manual, but it will be in the program policy manual for the 2017-2018 program academic year, is the optional course of Nursing Essentials 1, and that is the CNA course that can be taken here on the Ottumwa campus, and there is a clinical associated with that CNA course too. But we have heard we've heard a lot of feedback from regional hospitals that someone with that skill set of not only health unit coordinator, but also Nursing Essentials 1 or being a certified nursing assistant would be much more valuable than someone without those skills, because that would enable the hospital, that person could work in patient tech a role and have those responsibilities in addition to the health unit coordinator responsibilities. So if you have questions over any of those 4 programs, you can feel free to contact myself, Sarah Cottington, the program director here, and we can discuss your questions in more depth then too. And we'll have a Q&A session at the end of this, but Okay, so the next part of the program policy manual is the course descriptions. And again, what is highlighted in green, and it's not going to print that way, but it is in the electronic copy because we usually print the manuals in black and white. But you'll receive this electronically. And so what is highlighted in green there are the prerequisites that are required for those courses. So you can see that HIT 125 and HIT 126 don't have prerequisites. Those are the introductory courses that are taken in the first term. However, going on the courses later on in terms 2 and up do have prerequisites, and they're listed there. So for example, to take HIT 130 Health Record Systems, you would need to have completed HIT 125 and HIT 126 with at least a passing grade of at least C or a 78%. And so you can review those at your leisure. It continues on through the coding and the professional experiences. Professional experience 1 and 2, are designed to be taken in sequence. And that is with any of the three programs, even HUC or HDS. Okay, so the next section, there are some things that I mentioned are applicable to all Indian Hills students. You may never be physically on the Ottumwa campus, but those are things that we want students to be aware of, and that they know that those resources are out there, whether you're on the campus or off campus, even at your professional experience site. If there's accident or injury or anything outstanding occurs, please contact the practicum supervisor and report it, and myself, the Health Informations Program Director. So we do require the MIC and HIT students to attend their state or regional HIM annual meeting. Most states have they're called CSA associations, or a state association member of AHIMA, the American Health Information Management Association, and they have annual meetings. Those hours of attendance would be credited towards professional experience 2 or professional experience 3 for the HIT students. Usually it works out to whatever a full day, would be 8 hours. That's usually what we allow. And that would be applied then towards your 200-hour practicum for 2 or 3. So it's a great opportunity to meet potential employers and network with other students and also the other professionals within health information, because I can tell you this personally, it is a very good thing to get involved in the association and to understand some of the political things around our profession, because AHIMA works very hard to lobby for health information issues, and it's very good to be involved and understand all of that, but also to network and get to know people so that you build a pool of people who, if you're in the future, when you're working somewhere and you have a question about, well, you wonder how this hospital does it, or how this clinic does this process, or if you're involved within that association, then you have people and resources you can ask those questions of. So I can tell you this too personally. Every good job that I've ever had in my career has been through a word of mouth referral from someone that told me about the position or recommended me for the position. And even in our day and age of technology, as good as it is, sometimes the best positions are not even posted or advertised. Legally they have to post the position, but they may just do that internally, or so it's one of those things that it really helps to just be involved and be a part of our health information profession. The next part, I created this table to just help people understand for their program what the clinicals are and what the hours are. I had one student once who thought that the very first practicum, she could just, all she remembered was 440 hours for the HIT program, and that's the total number of hours. But she thought the first clinical was 440 hours. So it's just another place to break it down and hopefully give you a better understanding of what clinicals are required for each program and what each one entails. You can always, anytime, ask myself or Carol questions about the clinicals, and email us or call us or set up. We would love to talk to you in person too. If you want to set up an appointment with us and come in and meet with us, that would be great too. For your practicum experience, there are certain requirements to be cleared for clinical. And last year, Indian Hills Health Sciences as a division began utilizing Castle Branch as the documentation warehouse and the the check that facilitates that clearance. So each of these things with criminal and abuse background checks, you're going to have a state and a national check through Castle Branch. HDS students will complete their background check through one source, because they are not required to have a Castle Branch profile. Their practicum is completely online, facilitated by us, the HIT faculty here at Indian Hills. So since they're not in a physical clinical setting, they don't have some of the other physical exam requirements and vaccination requirements. So there's the background check. This is a table guide of those things. Don't think that you're automatically disqualified. Life happens, and so it's one of those things that there have been students with things that are still able to be cleared for clinical. However, a felony conviction does kind of rule that out. And so if something like that would come back on a background check, we would do our best to help you transition to a program that would allow for that background. But all of these things that are required to be cleared for clinical, the background check, the drug screening, the drug screen test, they're things that the hospital requires, or a physician clinic or any healthcare organization is going to require of their employees and volunteers and students. So there's the drug screen, and then there's a lot of documentation around the drug screen. So I'm going to skip ahead to, and then it goes right into attendance. There's also a physical exam that's required. Of course, the attendance, I feel like that's common sense, but you are required, once you have an approved schedule, to follow that approved schedule or notify your site supervisor immediately if you're going to be late or if you're unable to attend that day, and also notify myself by email. The time must be made up, and some practicum sites, they've even said 3 absences and an employee would be fired or terminated. And so absenteeism is a big issue for employers, and you need to look at the practicum as the same as an extended job interview, because we have had students hired because of their practicum experience. And so, you're representing yourself as a future employee, but you're also representing Indian Hills and our HIT, MIC, HUC programs that you want to be professional and on time and dressed appropriately. So these are a few. There's the dress code also, which is pretty much business casual. However, there is a yellow polo shirt for the health unit coordinator program. Here's the page. Oh, and I should say that's available through the bookstore. You can order that through the online bookstore here at Indian Hills, and it has the Indian Hills HUC program logo. Okay, so the physical exam is required for HIT, MIC, and HUC students. The details of that are on the physical exam form and within Castle Branch with the requirements. There's also a documentation and results requirements of the following immunizations and tests: MMR or a rubella titer, 2-step TB test for tuberculosis, tetanus diphtheria booster. That is required within, you have to have a Tdap or a tetanus booster within every 10 years. Optional vaccines are the hepatitis B and varicella. And more, it says optional there for influenza, but a lot of hospitals require from September 1st to April 1st that all of their employees, volunteers, and students have the influenza vaccination. There's a pregnancy policy, and then also bloodborne pathogens and HIV. Another thing that we do require within My Hills is bloodborne pathogen training. There's a module on HIPAA training and also mandatory reporter training. And those modules will be completed in My Hills, and then you'll upload the completion certificate to Castle Branch. And there again, that documentation must be completed before you'll be cleared to attend clinical. So here's a little bit about the grades and the core courses. Again, you know, what I've been trying to drive home with is highlighted in yellow there, that you must pass the core courses with a minimum of a C or a 78% to progress in the program sequence. Now, some of the other courses that are electives, such as basic anatomy and physiology or pathophysiology, computer essentials, those courses, of course, I would hope that you would strive for an A and do the best that you can do. But if you received a D in that course, that would still be a passing grade, and you would be able to continue on in the program. So we're getting to the end here. That's the grading scale, and you're welcome to conference with us if you have a question about your grade or anything within the courses. We try to take a hard look at grades during midterm, of course, and guide the student the best we can. It's one of those things too that sometimes through no fault of the student or the practicum site, sometimes practicums do run over the terms. But any coursework not completed would receive a grade of an I, which would be incomplete. And that incomplete coursework must be completed within the first initial weeks as soon as possible. It must be completed as soon as possible, and is at that time not incomplete won't be changed until the coursework is completed. Incomplete grades, if the coursework's not completed, would be automatically converted to an F within the time period specified there. So of course, again, you know, if you have a question about anything, please contact us. It's always better to be proactive and not wait. Contact us as soon as you can. So there is a grade appeal process. That would be the link for the Indian Hills process is there, and ultimately would end up with the Academic Standards Committee. But if you don't agree with an instructor there, that's the process you would follow for recourse. We follow academic honesty, and plagiarism is something that you can't, just don't do it, okay? Don't do it. Any reference must be cited. You can't just copy and paste. We want things to be original thought and original composition, and violation of the policy of academic honesty would result in a 0 or an F for that assignment. But also something that is new too is it would also be reported through the student behavior system now that Indian Hills has, and would be tracked college-wide. So just don't do it. There's counseling available that is through the Student Health Center, and the student health clinic services may be changing, but I have heard and they've confirmed that the counseling will still be available through the Student Health Center. And this is actually for academic counseling too. So yeah, now you know that side note about the Student Health Clinic, but also there's academic counseling available anytime. I'm always happy to sit down with students and figure out a plan, a curriculum plan, or what would be the best course of action for that student. But that's available also through the Associate Dean and the Executive Dean of Students. Indian Hills has a sexual harassment policy and also follows and adheres to the federal law of Title IX. And so anything that might happen, whether I mean, I realize you guys aren't on campus, but even at a practicum site, if something would happen, please let us know about that. And that would be taken care of there too. Placement services are available. We do our best to let graduates and students know about open positions that are in our area in Iowa. But also, again, you know, we have contacts with healthcare facilities, and you can, we have a Facebook page for Health Informatics, and so you're a part of that networking group. And I'll be honest too, regional employers know and recognize Indian Hills graduates, and they know that our graduates are good employees and good coders. So this is our staff directory with our contact information. And again, feel free to email anytime if you have questions. We do require, I should mention that we do require HIT and MIC students to become a student member of the American Health Information Management Association. This is a $45 cost, and the information is given within the orientation materials. However, it is a part of HIT 126 Health Records Laboratory that you'll submit proof that you're a student member of AHIMA. HDS students and HUC students are highly encouraged to become student members of their associations. And right now, AHDI is actually waiving the membership fee for students. So I would highly encourage you to join that association if you're an HDS student. HUC students can be a member of the National Association of Health Unit Coordinators, and that currently is $35 for the first year. So another thing that I want to note is Indian Hills business hours are Monday through Thursday, 7:15 to 4:45 p.m. And email, even, you know, you'll have to look at the course syllabi for that instructor's contact preference. However, myself personally, you can email me anytime. I try to respond to email within 24 to 48 hours. Sometimes I get behind if we're at the annual meeting for Iowa HEMA, or if we're on break too from classes, but I make every attempt to respond within 24 to 48 hours. So email is probably the best form of communication. So with that, again, if there's any questions, feel free to email me. Check out the program information folder within the Health Informatics organization. I try to post the schedule for each term out there in the organization too. So there's several different things. If there's any announcements that come out, those will be sent by email to you, because sometimes there's scholarship opportunities or things that we'll post in that organization. So I thank you for your time, that you've listened to this recording, and hope to work with you in the future, and hope you have a great term. Thank you.